Walking is one of the best exercises you can do for your new joints. Start with walking around your home, then gradually progress to walking longer distances on level surfaces. Your healthcare provider will tell you if you need to limit how much weight you can put on your new joint. You may be instructed to use a walker or cane. It is important to follow these and other safety instructions after surgery, such as using a handrail when you go up and down steps. You will be given an exercise program that you must complete every day during your recovery. Be sure to do the exercises and let your healthcare provider know if you have any questions or concerns. Stretching and strengthening exercises are some of the best ways to get the most movement and function out of your total joint surgery. Right after surgery, simple activities like putting on pants or shoes may feel challenging. Your therapy team will teach you ways of staying safe and making daily life easier. You may be advised to use a reacher to reach objects on the floor or high up in the cupboards. Do not bend down to pick things up. Using other kinds of equipment, such as a long-handled shoehorn, can also make your recovery go more smoothly. You might find that wearing stretchy pants that pull on or shirts with buttons make getting dressed easier. As you become more active, you may notice soreness or even swelling in your leg. If you have been given compression stockings, be sure to wear them. Taking your medications as prescribed can make it easier for you to complete your exercises, participate in therapy, and return to your daily activities.